Marshall County is one of the hardest hit areas in the state of Iowa for coronavirus. 647 cases have been reported there, along with 2 deaths. So what are things like in the only hospital in the county? Joining us now is Dr. Lance VanGundy, a doctor at UnityPoint Health in Marshalltown. And doctor, thanks for joining us.
Absolutely.
Tell us what the situation has been like in the only hospital there in the county with the coronavirus cases continuing to rise in Marshall County.
Yeah, I don't know that the boat that we're rowing in is any different than any of the other hospitals across the nation. Our volume certainly doesn't compare to New York, but the healthcare environment battling coronavirus is changing for all of us. There's a steep learning curve figuring out how to protect your staff and yourselves and how to still take care of all the normal emergencies that come in, but then some of the algorithms for what you might normally think of about how to take care of people seem like they're turned upside down for coronavirus patients. An example is just how rapidly what would be a young, healthy person might suddenly become ill. Sort of defies your logical understanding of how normal heart and lung disease work. So we're adjusting like everybody else. We have great support with the UnityPoint system and all of the hospital systems in central Iowa. So even though sometimes the acuity of our burden might be a lot for our small community hospital, we've been able to have good coordinated care with the other hospitals in our system, and that certainly has helped.
So in terms of staffing and beds and PPE and those type of issues at the hospital, have you experienced any difficulties to this point?
I think challenges would be the right word. The one thing Iowa benefited from in being somewhat of a rural state that's not as densely populated is we had a little bit more time to learn from the experience of our partners in healthcare in other parts of the country. So we had time to assess what are our needs for PPE, how do we strategically think about staffing, and that delay of even just a few weeks was incredibly helpful. Behind the scenes, administration really has been working hard to not only stabilize our availability of PPE, but also think kind of creatively about staffing. I know one of the things that UnityPoint is looking at doing, if we have to, as an example, would be to disaster credential any ER provider to go work at any of the ERs that might be getting hit. So for example, if Fort Dodge all of a sudden had a massive influx of patients, but Marshalltown was stable, then maybe some of our providers could go help out there. And that type of goodwill across the system has been well organized, mostly because we've had time to kind of strategize.
How about the testing component? So important, yet there are so many people in that realm of deciding who gets tested, when do they get tested. Do you feel like testing in and around the Marshalltown area has been adequate?
It's a frustrating question. I think that we're trying to all diligently follow the CDC guidelines, but if we speak honestly, no, across America, there's not enough testing. We labor and stress with those decisions just like patients do about whether to come in. So we're trying to still, test people who are definitely symptomatic and have risks and exposures, the people who are obvious high risk. I can review that list for you if you'd like, but we don't have the availability of testing that we do for, say, a rapid strep test or an influenza test. But we've also been wrestling with those diseases for several decades, and we're good at taking care of them and identifying them. And coronavirus has really only been on our shores for 3 months. So I do think we have to answer that question with a little bit of grace and forgiveness to the medical system as a whole, just knowing that we haven't had enough time to become experts at this in terms of taking care of it. And so could we use more time? Absolutely.
Well, I know that you know that all Iowans appreciate the work that you and all frontline healthcare workers are doing at this time in making the sacrifices that you're making. Dr. Lance VanGundy with UnityPoint Health in Marshalltown, thanks for joining us.
Thank you.